The researchers suggest bringing along the bacteria Cupria vitis necator, which could synthesize the biopolymer polyhydroxybutyrate, or PHB. Space explorers could then use this material to 3D print structures and devices they need, rather than bringing them along. Here's an icky fact. That elevator button or doorknob you just touched likely has flu germs on it. Ugh. To avoid the flu, wash your hands often and the right way with soap and water for 15 to 20 seconds. Soap and water works better than hand sanitizer, so wash when you can, but sanitize when you can't. Research using identical twins has shown that diet trumps genes in terms of the level of health you achieve. The science of epigenetics also challenges the conventional view of genetics, proving that environment determines which traits a gene will express, and that your fate is in no way written in stone, even if you have genetic predispositions. Tell your doctor about all your medical conditions, especially if you have a history of irregular or abnormal heartbeat, stroke, breathing, or liver problems. Splashing around in a pool is fun, but water that becomes trapped in your ear isn't. In fact, it can lead to infection. To keep your ear nice and dry, dilute rubbing alcohol with white vinegar and put a couple of drops in each ear after swimming. Risks include peritonitis and the loss of protein in the dialysate, which could precipitate hypoalbuminuria. It's also important to consider the patient's comorbidities and the risk of developing hyperglycemia. IgG binding and complement deposition each correlated with a mean consecutive difference on single-fiber electromyography. We concluded that a proportion of patients with SNGMG or OMG have clustered AChR abs that correlate with their electrophysiologic features. GLP-1 receptor antagonists stimulate insulin release from pancreatic beta cells in a glucose-dependent manner, inhibit glycagon release, delay gastric emptying, and increase satiety. Natural GLP-1 has a very short serum half-life due to the proteolytic activity of DPP-4. Sodium glucose cotransporter type 2 inhibitors prevent reabsorption of glucose from the glomerular filtrate in kidney nephrons.